Hey everyone, I thought I would do a series of videos about my experience with my aortic valve replacement surgery that I'm having tomorrow to give everybody lots of information about the tests I've gone through, how I got here, and to talk a little bit about what tonight and tomorrow will be for me. And then I hope to do at least one video per day starting tomorrow to talk about how I'm feeling, how I'm recovering, um, when I might be moved to my own room, and when I might be coming home, and how much better I'm feeling each day and each day afterwards. Um, the reason I'm having this surgery is because I've known for a very long time that I have a bicuspid aortic valve. It's a congenital defect that about 1 to 2% of people have. So it's very, very common. Um, that means I have two leaflets on my aorta instead of the common three, which means my aorta doesn't open as much as a normal one does. And that causes a condition where calcium builds up on the valve leaflets earlier in life than it would on a normal 3-leaflet valve. So to fix this, there are a couple options that are viable. One of them is what I call the easy option. It's called TAVR, transcatheter aortic valve replacement, which is a process where very similar to getting a stent in your heart, where they go through an artery in your groin to push a new valve into place right inside your existing one. Use a balloon to expand it into place, and it just immediately starts taking over. The other option is a surgical option, which is the one I have to do, where they will make an incision in my sternum and go into my heart, my aorta. They'll open up the aorta. They'll cut out the old calcified valve. They'll sew in a new valve, either made from pig valve or from cow heart tissue valve. It won't be mechanical. And then they'll sew me back up, and then it'll take me about 2 or 3 weeks to mostly recover. The reason I'm having the harder surgery instead of the easier one is because these valves last on average about 10 years. And if they do the surgical harder procedure for me now, while I'm still young and can recover quickly, then in 10 or 12 or 15 years, when I need to have that one replaced, then at that point they'll do the TAVR through the groin and just insert it into that existing one that they're putting in tomorrow. There's a couple things I had to go through to get here. One was visit the valve clinic at Baylor Medical Center, downtown Dallas. The valve clinic involved a series of tests that they performed to determine which of those two procedures I was best for. It included, they did a CT scan from my neck all the way down to past my groin to view all of the heart arteries and veins, as well as to see the condition of my aorta all the way down and the iliac veins that go down into your legs, which is what they would use if they did the TAVR. So they need to be able to see that beforehand. They used contrast to be able to do that. It also gave them a more accurate view of what my valve actually looks like, so that they can better determine which surgery to choose. They also did an ECG on my chest, which is where they put all the leads on your chest, and you get the printout of the heart rate to see what that was. And they did a lot of blood work, basically the same kind of blood work you get when you go to your doctor to check for all of those various different things and make sure everything was in alignment. Everything came back good for me on all that. I'm pretty healthy except for my heart valve, but because of my age, I'm 50, and the size of my aorta, the doctors determined that surgical valve replacement was the best choice for me. After that determination was made and surgery was scheduled, which is tomorrow, I had to go through pre-admit testing on Tuesday. Tomorrow is Friday. And that included a COVID test because we're still in those times, which came back negative. They did another ECG, and they did some more blood work, including determining my blood type, in case, for whatever reason, they might need to give me blood transfusions during the surgery. So that's all done. Tonight, I'll need to make sure that, I shower. They've given me some antibiotic wipes to use to keep bacteria off of my skin as much as possible. And then I have to do that with the wipes again tomorrow before we head to this hospital. We have to check in at 5:30 in the morning, and my surgery is scheduled for 7:30. I'm hoping that I can do one more of these videos before I go into surgery, and I'm hoping I can do one after I wake up in the ICU tomorrow evening, just to kind of give everyone a sense of how I'm feeling. I'm going to be in some pain. It's to be expected. So that's where we're at. I appreciate all the love and support that I've gotten from my friends, from Facebook. It really means a lot to me, the love that I've gotten and support I'm getting from everyone online. So I appreciate that. So hopefully I'll talk to you in the morning before surgery and one more time after I wake up. Bye.